Hello everyone, I'm QR Sinceri from Redox, and I'm here with Jerry Berger from Samsung Health. And Jerry, just tell the people a little bit about Samsung Health and what you all are working on currently.
Sure, well it's funny, one of the things I'll be talking about in my presentation a little bit later on this morning is not many people realize how broad of a footprint that Samsung has in the healthcare market. First of all, over in Seoul, South Korea, we own 2,400 beds.
Wow.
Okay, so we're probably the only technology company out there who owns hospitals. We have cancer centers, we make modalities such as CTs, ultrasounds, we're also in genomics, we're also in pharmaceuticals. Besides all the devices that people utilize in a hospital setting, from the time they walk into a hospital to the time they go home, and caretakers coming into people's houses to take care of, for example, people who are discharged or seniors.
Wow, that's a lot of things to focus on. And I know one thing that you're pushing a lot in your marketing is the wearable devices that you're currently offering. What is the device you have in your hand currently?
Sure. One of the things that is the wearables that Samsung is pushing out in the marketplace that people can wear, obviously trying to be hands-free. There's a lot of things you can do with this wearable. For example, it will measure your heart rate. It'll also measure how many steps you're taking. It also measures how well you're sleeping. And all that information is then going into the cloud, and then either a caretaker or a doctor or someone can then take a look at that data over a dashboard and be able to monitor people. So it's a case of not just a case of people coming back from the hospital and they're given a prescription, but now they can maybe be discharged with a wearable, or they can also wear it for their own wellness and be able to get that information on a daily basis.
And so how are clinicians utilizing the data that they're getting from the wearables today?
Sure. Well, for example, we have the capability with various, with a middleware, which allows various hospitals or organizations to connect to the watch through the APIs, okay? So all that information is flowing to the persons or people who are monitoring. It could be someone who is discharged. So for example, if someone leaves a hospital, they're all of a sudden sent home with a kit. And one of the things with the kit would be a wearable. And so they could press it, they could either connect and call the doctor, they could also take a look at where their vitals are, but all that information is going through the APIs and going into a cloud, and someone's either at a hospital or some type of healthcare facility monitoring the patient.
Awesome, awesome. So the state of wearable devices is very, I would say very still early stage. We're seeing the rise of the Samsungs and the Apples, and we're seeing the fall of some of the bigger brands like the Fitbit. Where do you see wearable devices heading in the next 10 to 15 years?
Well, it's really one of those things. It's funny with wearables, you're right. And right now it's a little bit still in the early adopter stage, okay? Because one of the things with the wearables is the price, okay? For example, a watch. Some people might say, geez, I don't want to pay for the full price of a watch, even though it could do these many things. But what they'll see is that with all this information, they're able to do better wellness. For example, also with a watch, you could do geofencing for an elderly person, so if they leave outside their area, you, the caretaker, is notified, okay, immediately.
From the GPS in the watch?
That is correct, okay? So there's things, so with the price, but also what Samsung's looking to do is they're coming out with a new wearable. I think you had something that was like, it's on your wrist there. Yeah, exactly.
I can't show that one today, huh?
Do not show that one, okay? But I like them anyway, all right? So coming out with a new wearable, it will be where a watch right now is only about 70% accurate on the heart rate. This wearable will be 99% accurate on heart rate. So that way, that information can be monitored very easily. And there are also things on there be able to measure perspiration. It's going to be able to measure a number of different things because of the sensors on the wearable. And it's going to be relatively inexpensive. So once again, it's a case of a mass amount of people starting to be able to use it rather than a finite group right now that's just using the watch. And eventually what you're going to see is with the wearables, you'll be starting to see the sensors that'll be going inside the body. That's really what you're going to see in maybe 5 to 10 years.
Understood. So with the power to actually get 99% accurate heart rate data, I'm guessing that watch is going to be used in clinical trials, or?
That is correct. All Samsung devices don't go through clinical trials because they're not FDA approved, okay?
Right.
So that way it could be used on a consumer basis,
right.
All right? but there are hospitals who do clinical studies with the watches. For example, right now, we use the GS2 watch with Kaiser for cardiac rehab. So when someone is discharged from from Kaiser's hospitals who might have had bypass surgery or something, all right, there is a particular application that's on the watch that's devised by Kaiser, in which the person is sent home with a watch. The whole goal is, and some people would say, geez, you're monitoring every single little thing you're doing. Actually, from a Kaiser perspective and from a Samsung perspective, our goal is not to measure every little thing. We just want to get them up and moving. So, what will happen is the watch will show alerts. Hey, did you move today? Did you get up and walk? Did you do this? Very somewhat simplistic task, but it's amazing how with those simplistic tasks, what the outcomes could be. What we're seeing so far with the cardiac rehab app on the watch from Kaiser is I think it's 1 out of every 4 people who have been using it, it's almost saved their life, okay? Because they've been getting up and moving, all right? Where some people, when they come home from bypass surgery, where they're not moving and they get readmitted to the hospital and things like that.
Right.
These simple tasks are helping people.
Okay. That's powerful.
Very powerful.
Yes. So, last question, but Elon Musk and the whole transhumanism wave, where he's talking about connecting the brain to the computer interfaces, and essentially we'll have the next evolution of the connected human. What's your thoughts on that whole concept?
I can tell you right now, it's outside my pay grade, but but I know those are futuristic type thought patterns.
Yes.
I'm not sold. I mean, who knows what 10 or 15 years down the road right now.
Right.
I think the main thing that we're trying to do from a Samsung perspective is that even with all these devices, there's a kind of a mantra that we try to follow at Samsung. They have to be easy, secure, and connected. They have to be easy to use. They have to be secure, so that makes sure the data doesn't go into the wrong hands, all right? But they have to be able to be connected, okay? And right now, we're still having a difficult time, with various applications, Bluetooth, this, that, to be able to connect all the devices so the information can easily flow into some type of cloud so that people can do predictive analytics with it. Wow. So that way someone can say, geez, what we're seeing is that when this person's walking around with the watch, there might be an 85% chance that they might fall within the next 24 hours because we're seeing gyrations in their movements, and we're able to record that.
Got it. Well, thank you for your time, Jerry.
Q, that was a pleasure. Thank you so much, and enjoyed the conversation.
Appreciate it, Jerry. Take care.
Thank you.